Question 1. Which chamber of the heart pumps oxygenated blood into the systemic circulation? The right option is D. Left ventricle. Question number 2. Which blood vessel carries deoxygenated blood from the heart to the lungs? The right option is B. Pulmonary artery. Question number 3. Which valve prevents backflow of blood from the left ventricle into the left atrium? The right option is C. It's mitral valve. Question number 4. What is the natural pacemaker of the heart? The right option is B. SA node. Question number 5. Which blood vessel is the largest artery in the human body? The right option is C. Aorta. Question number 6. During which phase of the cardiac cycle does the heart muscle contract? The right option is B. Systole. Question number 7. Which part of the heart receives oxygenated blood from the lungs? The right option is C. Left atrium. Question number 8. Which vessels supply oxygenated blood directly to the heart muscle? The right option is B. Coronary arteries. Question number 9. Which blood vessels have the thinnest walls and are the main site of exchange between blood and tissue? The right option is C. It's capillaries. Question number 10. Which valve lies between the right atrium and right ventricle? The right option is C. Tricuspid valve. Question number 11. How many chambers does the human heart have? The right option is C. 4 chambers. Question number 12. The muscular layer of heart valve is called the. The right option is B. Myocardium. Question number 13. The innermost layer of heart wall is called the. The right option is A. Endocardium. Question number 14. The sac that surrounds and protects the heart is called the. The right option is C. Pericardium. Question number 15. Which chamber receives deoxygenated blood from the superior and inferior vena cava? The right option is B. Right atrium. Question number 16. Which chamber pumps deoxygenated blood towards the lung? The right option is B. Right ventricle. Question 17. Which vessels return oxygenated blood from the lungs to the heart? The right option is B. Pulmonary veins. Question number 18. Which valve is located between the left ventricle and the aorta? The right option is D. Aortic valve. Question number 19. Which valve prevents backflow of blood from the pulmonary artery into the right ventricle? The right option is B. Pulmonary valve. Question number 20. The septum of the heart primarily functions to. The right option is B. Separate oxygenated and deoxygenated blood. Question 21. Which structure normally delays the electrical impulse before it reaches the ventricles? The right option is B. AV node. Question 22. The bundle of His, which is specialized group of heart muscle cells that transmit electrical impulses, is also known as the right option is B. Atrioventricular bundle. Question 23. Which fibers distribute electrical impulses throughout the ventricular myocardium? The right option is A. Purkinje fibers. Question 24. What does an electrocardiogram or ECG primarily record? The right option is C. Electrical activity of the heart. Question 25. Which wave on a normal ECG represents atrial depolarization? The right option is A. P wave. Question 26. The QRS complex on an ECG represents. The right option is B. Ventricular depolarization. Question 27. The T wave on an ECG represents. The right option is C. Ventricular repolarization. Question 28. The first heart sound S1 is mainly produced by closure of the. The right option is B. Mitral and tricuspid valves. Question 29. The second heart sound S2 is mainly produced by the closure of the. The right option is A. Aortic and pulmonary valves. Question 30. Which artery supplies most of the left ventricle with oxygenated blood? The right option is A. Its left coronary artery.